Welcome to this episode of Jing TV. We're going to deal with one of the biggest things that lots of massage therapists have dealt with, which is how to treat frozen shoulder. And sadly, Andrew had frozen shoulder, and some of you might know it's one of my places of expertise. And Andrew lives in Liverpool.
I do. And
through our correspondence around design, at some point Andrew said to me, well, I've been diagnosed with frozen shoulder. And I said, what? We can deal with that. So we thought we'd just sort of talk a little bit about Andrew's experience with frozen shoulder, and certainly how I went about treatment and what you feel like made a difference. So can you tell the viewers when it first presented, and can you remember anything about it?
Yeah, it started off as, because obviously I'm stuck to my computer all the time. So it started off as a bit of an ache, and I just thought, oh, you know, I've done a Jinger have had me working on things far too long.
and late to the night.
And I thought, oh, it'll pass, you know, I've just strained something, and it didn't pass, and it started to get quite painful, and then it started inhibiting movement.
The locking down, so.
And I thought, oh, I'm going to go and see my doctor about this. And he said, oh, we'll just see how it goes, it might pass, and it didn't, it got worse. But I didn't go back. That was the thing. I should have gone back at that point and said it's got worse.
Okay.
And so by the time I eventually went back, I basically lost all movement down my left side.
And it was really kind of fully inhibited, wasn't it?
Yeah, so I couldn't go beyond that point, really.
So what we sort of see here is like a 30 to 40 degree abduction, which is all Andrew was able to do. And so he did fully lose his lateral rotation and completely, right? Yeah. No medial rotation whatsoever.
Yeah, to the point where to put my hands in my pocket, I would have to lift that hand up and tuck it in. It was almost paralysed, really.
And awful. How long, can you remember how long it was from the ache to the...
I'd say that was probably about 4 or 5 months.
Okay, so that's really classical presentation. So if we kind of go through that, so we know that clinical frozen shoulder is the losing of lateral rotation, abduction, and medial rotation within a period of time. Usually takes about 6 months, and then the classic when the GP or anyone says it's going to get better, they say it's going to take 18 months to 2 years.
Yeah.
And was that what you were told?
I was, and I was referred for physiotherapy. Okay. Which involves some stretching exercises, kind of trying to walk up walls and things. I mean, it's great. Look, I can do this. Yeah, it's great. But at that time, it was literally kind of I would be straining to get beyond that point. That didn't do a great deal. The
physiotherapy.
It didn't really help.
So effectively they gave you exercises?
Yes, but it didn't feel like it did. It was very painful, you know, that there was that feeling of no pain, no gain, but it was just pain, no gain, really, and I didn't feel like I was getting
pain, no gain, right?
Yeah, half of it was there. And so I just felt I was starting to feel really hopeless about it. I went back to the doctor and explained that.
And it affected your work too, right?
Well, yeah, it meant I couldn't drive a car because I couldn't do the gear stick because you can't keep doing that to do the gear stick. I couldn't. There was just loads of things, cooking, everything. I mean, I'm sort of mainly right-handed, but you know, I do a lot with my left hand. I am left-handed when I eat, so that was really hard and. I was in a bad way.
No, it wasn't good. It wasn't pretty.
It was terrible. And then they said, right, you need surgery. So that I was then put into the system to have surgery, and that was sort of, you know, that will come down the line in about 4 months' time. And I just thought, I don't want surgery.
So we kind of said to Andrew, well, look, let's deal with this. So there's a great massage therapist, that of course one of the Jing teachers, Tracy, and she did some treatment work on you. And then at some point I just came up, and it was actually one of the times in which I was able to do block treatment. So I think it was 3 days.
Yes.
And we did 20 minutes 3 times a day. And what can you remember from that? And we actually videoed it.
We did.
We'll have to find it.
I remember crying because it was so painful. But it was pain and gain on this occasion. It was stretching exercises, so it was about trying to applying pressure, and I pushed into the pressure. That's right. Which wasn't nice. But I did feel like I was getting somewhere. And then there were some overnight exercises as well around stretching, trying to get some movement back in.
So effectively what I did was the Jing protocol for the treatment of glenohumeral joint. So we did 20 minutes, which meant I did some myofascial release. I went in and did the 4 sits muscles. So I treated supraspinatus, infraspinatus, teres minor and subscapularis, in particular subscap. Of course, I know you remember all this well. And then, but mostly what Andrew's remembering, which was the things that you had to be more engaged with, was PNF stretching around the movements that were the most difficult. So that was resisted stretching for abduction and medial rotation. And what we did was we videotaped his range of movement before. We did some PNF, and then we videotaped it afterwards. And the increase of range of motion was startling. It was quite impressive. So where we were starting with 30 to 40 degrees, before I left at the end of 3 days, you were definitely above 90 degrees. You were definitely kind of around here. And I think I was only there for a short period of time, and I think what happened also through that time, and you can say, is just knowing it could get better through manual therapy makes a huge difference. Even if it didn't stay, it psychologically means, okay, I don't have to have my whole shoulder ripped out or keyhole surgery or whatever was going to happen.
Yeah. I mean, to the point where eventually because I carried on doing that, the exercises afterwards, the stretching, and eventually, because what it felt like was happening was I'd get so far, and then the next day I'd have lost a bit.
Right.
And then I'd get a bit far, and then I'd have lost a bit more again. So it was a gradual thing. But what happened was, by the time the surgery came around, I'd got sufficient movement back to not warrant having to go through it, because it was probably only about another 10% that I needed before I was back to normal.
So we avoided that.
Yeah, so I never ended up having to have them
great
doing
success.
horrible stuff. Yeah.
You know, and this is really key. And I think you know, Andrew's dedication to his own treatment made a difference. So him continuing to do the exercises I gave him, having general massage therapy and, you know, clinical massage therapy, 6 or 8 sessions, and then this block work, which was really just PNF work. And this is something that if you can suggest to your clients, can make a real difference in all aspects, because part of the whole breaking the cycle of pain is empowering people to know a difference can be made. So, you know, we just thought this might be a good case study for Jing TV and anybody who's interested in out there. And all of these things are taught on the Jing 2-day course in shoulder girdle. So, you know, if it's something you're interested in, it's just 2 days, and we teach it a couple times a year. So come along, but enter into the discussion on Facebook and Twitter, and we'll see you at some point at Jing.